Across Australia today, more than 90,000 new cases of COVID. Queensland spiking to more than 20,000. Hospitalisations continue to climb as New South Wales and Victoria record the highest number of inpatients since the pandemic began. Daily case numbers in New South Wales remained low as rapid test results continue to go unreported. But that's scheduled to change tomorrow.
We will have a system in place which allows people to register their positive RAT test and connect through to health.
While it should give a clearer picture of the real numbers in New South Wales, the growing hospital crisis in Sydney and Melbourne shows no sign of slowing.
Yesterday there were 3,992 hospital staff that were not available to work because they were either COVID-19 cases or close contacts. There were a further 422 Ambulance Victoria staff who are unavailable to work as well.
In New South Wales, staffing issues are being compounded by the sheer volume of patients.
It's more difficult, even though the case numbers in intensive care are lower than when we had Delta. It's proving to be more challenging and more difficult. And the main reason is the furloughing of staff.
As the hospital system struggles, the combination of sky-high case numbers and bringing forward booster dates right as we open up vaccination for 5 to 11-year-olds is taking its toll on GP clinics.
Most GPs report that it is very difficult for patients to get reasonable and timely access to general practice at the moment, whether that's because books are incredibly full at the moment by vaccine requirements and also by the number of COVID positive people we need to manage via telehealth.
But some GPs are saying it was this advice from the PM that tipped their clinics into chaos.
People who have COVID should contact their GP. They should let them know.
Many people, some of whom don't even have a positive rapid antigen test, are calling their GP simply to ask for clarification of what should I do next.
So, with no clear picture of when the peak will hit, can our GPs hold on until the tide turns?
Well, Dr. Chris Moy is a full-time GP and also the Vice President of the AMA. Dr. Chris, what are you seeing across the GP network? What are you hearing from your colleagues?
Oh, just an overwhelmed and exhausted workforce, which has been through COVID and been the foundation of the vaccination program, just suddenly getting slammed last week with sort of queries, because I think what you're seeing is just the overwhelming of the hospital system to be able to manage the huge number of patients with COVID, and suddenly that whole burden shifting right onto general practice just when we're trying to embark on the far biggest part of the vaccination program. That's the boosters in children in the next month or so.
And what did you think when you saw the PM say that COVID positive people should get in touch with their GP? Like, I've just recovered from COVID and I can't book in to see my GP for another 2.5 weeks. He's just not available.
Yeah, I think that was right off script, actually. I think that the idea is really that the report should still be to the state system so that the numbers can be counted, but also so that the high-risk patients can be sifted out who may need things like the monoclonal antibodies and sort of high-level treatment. But I think the flip side is what we need is good education for patients about when to call ambulances and when to call their general practice. But at the same time, we can be looking after some of the patients, but we don't need to know everybody that's positive. What we need to know is the patients that actually are struggling. And that's where the education comes in. But also we need that resourcing, which hasn't been there. We need sort of at the moment, sort of the longer telehealth, telephone consults again, some funding to take all the phone calls, which we got slammed with last week. And also things like a lot of the PPE, pulse oximeters and the RAT tests, which unfortunately haven't got to us, because what we need to do is be able to provide those to our patients to be in this very, very difficult time for them.
So, Chris, how should positive cases be managed then?
Look, a positive case should still report to the state system. There should be a triaging of the high-risk patients. As I said, some of them are going to need things like monoclonal antibodies and things like that. But then for the vast majority, 85% of double-vaxxed individuals are going to be totally fine. They're going to have relatively minor symptoms. But they need to know when to call. So they need this education from things like Health Direct and also from the National Coronavirus Helpline. Look on the symptom checker. But they need to know when to call their GP then for help, because sometimes they're still going to need to get some advice about how to manage their COVID symptoms, and they're also going to need some help if they're starting to get worse, and we may need to sort of link them into higher level services.
So if you were to give the larger health system a checkup right now, how would you say it's faring?
Well, it's heaving. Look, I think, we have a good health system, but it has been underfunded for a long time and there hasn't been a lot of fat. And I think it's been exposed at the moment. I think the thing that we have to learn now is that, in this sort of situation where we need a bit more, it's hard to do that and we're really struggling and things are unfortunately starting to fall through the gaps. Health is an investment, and I think that's a lesson for the governments in the future. If you have a little bit of a gap and a little bit of extra fat in the system, then it may be able to take a little bit more. But unfortunately, it's heaving at the moment.
Dr. Moy, Queensland's Chief Health Minister, Officer, blasted people for hosting COVID parties on the Gold Coast. It brings a new meaning to the word toolies. What would you say to people who are deliberately trying to get COVID at the moment?
No. God. I mean, it's a bit like, unfortunately, Minister Hazard going out and says we're all going to get it. No. We might all be exposed to it, but what we don't want is everybody sick at the same time, because some percentage of us are all going to end up in the hospital at the same time, and that's going to overwhelm our health system. What we need to do is to try and slow this down as much as possible so we don't get this huge peak of people in hospital at the same time, also furloughed staff as well. And what we need to do is buy time to get as many boosters in people's arms, because it's much better to be exposed once you've had a booster. And we don't know about things like long COVID and things like this. So Omicron is not as benign as everybody wants to make out to be. So no, please don't do that. You're actually really making things much worse for us by those sort of actions.
Really appreciate that clarification, because Tom Cashman will literally do anything to get invited to a party.
That's it. Any disease.
Dr. Chris Moy, thank you very much for your time.